Well, they needed it and they did it. Senate Democrats have the 60 votes they need to bring their health care reform bill to a vote. Senator Ben Nelson of Nebraska, the lone holdout, no more among Democrats until he won some major concessions, which he got. So now the bill can move forward despite zero support from Republicans. Joining me now on the phone from Washington is Michael Steele, chairman of the Republican National Committee. And I want to mention that we did reach out to Democrats to also participate in the discussion. None were able to join us. Michael, thank you for being with us.
It's great to be with you, Jamie.
Talk to me about how this came down today. What's your feeling about what Senator Nelson got for his state and how the 60th vote was put in place?
Well, you know, I thought about this as it was unfolding today, and it became very apparent to me that the weather wasn't the only thing that was frightful in Washington today. It was certainly what the Democrats were doing on the Hill, and the fact that Americans are one step closer to having their health care controlled by the federal government. And I think the price paid is a dear one. It's not just what Ben Nelson bartered and negotiated for the state of Nebraska. That's nice. Now the other 49 states want to take a look at that deal because he's got the federal government paying for their Medicare costs forever.
Well, tell me, what would a Republican plan look like?
Pardon me?
What would a Republican plan have looked like?
I mean, you know, we've been saying from day one of this debate that the step-by-step approach that looks at strategic areas in this healthcare system that needs to be fixed. Why are we doing all this and not addressing tort reform? How do you begin to do this when there's $100 billion in tort reform possibilities and savings that are there? Why aren't we doing the things of making small businesses the real engine here, as opposed to levying more taxes and more regulatory burdens on them, and the like? So there's a series of things that we've put out, from making greater use of health savings accounts, portability, small business pools, a whole host of things that are just not a part of this, except for the taxes and the spending that's going on.
Well, we know the American public has certainly taken an interest in this issue. Thank you for telling us a little bit about what your thoughts are today. We appreciate it very much, Michael Steele.
You got it. Take care. Merry Christmas.
Same to you.